a little bit. So
Yes.
things that are bugging you will come out. So you have to warn people about that.
Yes. Kapalabhati is like a bellows breath. I think you
Like a
force
bellows.
exhalation and then you literally get rid of crap, I think. It's a very good thing.
Yeah. So
I
it
have
just
some,
helps you to release stuff, you know. And,
excuse me. There you are, Kapalabhati here.
and as you pointed out a minute ago, we all have stuff.
Oh, yeah.
Nowadays, we're all charged for different reasons. It is a difficult time around the world, and we all, need to release some.
Yeah, I think this is intelligence that works, first of all, without chemicals, without prescriptions, without antidepressants, and that's the fascinating thing. You don't need the doctor to tell you, just go do it. And once you do it and do it and do it, it actually comes up automatically. That's what the nurses were saying. You don't get phone calls. So once they take it seriously, boom. You mentioned music, and there is some research on parasympathetic and heart entrainment where they're really entrained, and 0 0.1 hertz. And this Benedictine nun actually studied different kinds of music, like hard rock, metal, which is terrible. Don't listen to that. Then she went into classical, Mozart, and it really does engage. But the best one, and I went, whoa, this makes so much sense. Because I used to listen to this in my medical school library because I couldn't understand Latin. And in Scotland, they do Latin, and I can't memorize. It's not my natural tongue. But she said Gregorian chanting, monastic vocal chanting. She says they immediately go into entrainment. Your brain is synced. And I could remember things, and I didn't know why I was listening to this in my headphone. But Gregorian chanting. And I would say to people, if their kids or grandchildren are listening to hard rock and all that, be careful. Be careful. They're turning up the sympathetic drive, and it will be detrimental for their health overall. They get addicted to it too.
In the early 90s, Nisha, you probably were in this country already. There
No,
was
I
a
wasn't.
there was a
Uh-huh.
bestseller, how's that ratings for music?
Uh-huh.
And one of the top sellers was Gregorian chanting.
Really?
And with Catherine, we used to hear it all the time in the house. We still have the CDs. It's funny because our son was part of a choral, and the choral used to do Gregorian chanting too. So it's very relaxing. It's lovely.
Yes. And it's a good way for learning. You don't need to make effort. Somehow, the essential bits of information stick. You seem to file away the details. So when I came to my medical school exams, honestly, I was like, I don't know, I wasn't
Uh,
okay, and it was fine. It was fine, and I seem to know what to do. And it's that innate knowledge that the music opened the parasympathetic gates and kept them open because I would sleep very well. I never needed alarm clocks ever. I've never actually used timers or anything. I just know. And I think it's partly because of that. So classical and Gregorian chanting should be in our schools, to be honest,
yeah.
because the children relax. ADHD seems to be rampant. We hear that all the time. And I think, yeah, you can teach them Tai Chi, but put those headphones on. Now, for some of my practice patients, I actually tell them to go to solfeggio tones. Solfeggio is 9 tones, original, free on YouTube. And when you put them on, literally within seconds, your scalp relaxes and you can't think. I can't think. The
You
brain is
relax so
quiet.
much.
Yeah, the brain becomes quiet. And that's very fascinating. So for me, if I need to write or learn something, I can't do solfeggio. But for some of my patients who can't do breathing, they have CPAP machines or whatever it is, then they get headphones and listen to the solfeggio, and it works. It's quite wonderful. And fortunately, YouTube does have very good resources there. Yeah.
I think it's important to realize that we have control of this, right? I mean, we can
Yes.
control the immune system, but at times for patients it's too late, right? Patients that have very aggressive disease, very aggressive inflammation. So the question that I get asked is, well, if you can affect the vagal nerve, why don't you treat patients with that, right? And I think that for those patients, their treatments now, the very severe inflammatory patients and neurological patients in which you are stimulating the vagal nerve electrically.
Yes. Yes. And in fact, in Netherlands, they do that.
Yeah.
They actually insert a device in the neck at the vagus nerve. It's bioelectric medicine. And it's a Koopman and Peter Tack have done most of the work that I know about.
Yeah.
And they have had patients with the worst rheumatoid, Jose, who failed biologic after biologic after biologic. So they put this device there, and then they take a magnet and stimulate it over the skin. They hold it for 6 minutes twice a day, something like that. Boom,
It's
they go
really
into
amazing.
remission. Yeah.
So I brought it for you.
You
This
did.
is the vagal
Oh,
nerve, this is the device, right?
oh.
We have been doing it in the office. And
Okay, how do you do it? So explain that.
so it comes, a neurosurgeon positions the vagal nerve, of course you have two, and positions it and just sutures into the vagal nerve. And now you can see it.
Yes, I
And
can.
basically use a collar to stimulate it once a week for a few minutes.
Just
And
once a week. Wow.
yeah, and it releases a signal for 5 or 10 minutes every day.
Yes.
And they feel a little buzz, and that's it.
I didn't know that this was available in America.
And we do it's part of a clinical research project.
Yeah.
It is going to the FDA in 3 months.
Okay.
So it may be available in next year.
Yeah, because I usually tell my patients that this is coming. It's in Europe already, but in America, I know there are trials. I don't know how to get you in them. I do telemedicine only. But
Yeah.
this is very, very exciting. How many patients do you have in the trial?
We have only 5 in the office.
Yes.
And all of them did well. We have one that had problems, just external problems, and is dealing with some depression due to other issues, and another one that has had a bad fall and fractures, so not related to the inflammation, but the inflammation is controlled.
Yes.
It's really amazing.
Yes.
Yeah.
I have tried, and it's a company in Canada called Dolphin Neurostim, but it's outside, and I have it here. My chiropractor showed it to me. So you have a grounding, you put on your tummy, you attach the probe onto your ear, and you use this little device. You just switch it on, and for about 5 minutes, boom, again. Very easy. But there's no surgery. It's an outer device. You put your earlobe,
And that's another way probably to stimulate the vagal nerve, right? I mean, because
it's to stimulate the vagal nerve. It's called Dolphin vagal stim. And so some of my people, because I didn't know about this internal unit, I think for some of our refractory people, bioelectricity is really important.
It's an alternative. Yeah.
It is an alternative. Yeah.
It's not for everybody. It's very clear that most people need to do the breathing and the humming and the exercise or the music, because that helps us all to avoid the need for any additional interventions or getting sick.
Have you noticed from this vagal stimulation spilling into other health benefits or even in their life?
So the person that I told you, I mean, unfortunately, if you have fractures, you're off because you have a lot of pain. Another person had a very terrible loss in her family, so that just kind of imbalanced her a little bit. The other 3 are happy.
Yes.
They're happy-go-lucky now. They don't have pain, and they come
Yes.
in and they smile and they joke with me.
Yeah.
So yes, but I'm qualifying because it's a small sample. And
Well, but even one, you have to study that. What is it looks anomalous because you're not doing chemistry here. We're doing electricity
that's right.
of a major nerve. It's wandering nerve. So it balances many aspects of your body. I have seen people who are constipated forever and they stop pooping. Okay, that's been some, or another one who is literally able to balance their checkbook. Okay, their brain is so much better functioning. So this I say, wow, this is interesting that yeah, we get their inflammation under control, but they are getting other physiological benefits apart from just joint pain or
Yeah, I mean,
yeah.
if you look at it from above, right? I mean, you're affecting the autonomic nervous system,
Yes.
so therefore their anxiety will get better, the tachycardia will be less, right?
Yes.
The muscle pain will decrease, the bowels may click better, and you
Mm-hmm.
stop urinating every couple minutes, and
Yes.
can
Yes.
sleep better because of that. They're not getting
Right.
up during the night. So there's other effects that will overall make them feel better.
Yeah.
Just
Yeah.
balance the autonomic nervous system.
You know, many people may be watching this and they don't have immune diseases, but one very good way, and we've mentioned humming, the ear massage, and we'll do the 478 breathing. We must not forget that. But Heart Math Institute, the inner balance, coherence, I like it a lot. I used to have it, and some of my patients also use that because it has colors and they get very used to it. And over time, they just know they don't need the actual app, and they feed data to the Heart Math. They have collected so much information on people with all kinds of conditions,
Mhm.
including arthritis. So if people are watching this and they want to experiment, it's they have some free programs in Heart Math. You can actually go and look at it, and it's a small investment of time, and then you can also get into their programs and into their studies. It's really quite what they've done is quite incredible over the years. So Heart Math is another resource for
Yes.
people. Yeah, yeah, yeah. So 478 breathing, Jose. I'm not
Yeah.
letting you go without teaching us.
So I mean, Andrew Wild, as part of the training, sits with a group and teaches us this. And who better to teach you than him, right? I mean, he's the guru of this
Yes.
integrative movement. So it's relatively simple, and the purpose of that is to slow your breath. And there's two components because uh, what I add for people that feel a little bit nervous is the counting in their head.
Mhm.
So because the mind can only do one thing at a time.
Yes.
And if you're focusing your breath and counting, then you're not going and not wandering around
Hmm.
with worries or other things to do. So it's relatively simple. You take a deep, deep breath
Hmm.
to a count of 4.
Yeah.
You hold it for 7. And then you slowly, slowly exhale on 8. And at the end of the 8, you feel just a sense of relaxation
Yes.
and ease.